Hello ma'am, I am Noity Maginia and today I'm going to perform assessing the abdomen return demonstration. Assessment of the abdomen consists of inspection, auscultation, uh, percussion, and palpation. The physical examination of the abdomen is the key step in the evaluation of abdominal complaints such as pain, distension, enlarged organ or masses. To conduct of the procedure, first thing to do is to review client's previous medical records if available. Next is to prepare the necessary equipment needed to converse time and energy. The equipment that I'm going to use includes a tape measure. For the tape measure, and for the measurement of the patient's abdominal birth and sharp objects such as this ruler for the hypersensitivity test, and of course as the stethoscope to listen for patient's bowel sounds. Now I'm going to perform hand hygiene to protect the patient and myself as well from infection and cross-contamination. Okay, good morning sir. I am Loity Maginia, so your student nurse for today, and may I ask for your name and your birth date for verification? Sir, what is your name?
Jay Escabanis,
Your birth date sir?
October 12, 2004.
So today I'll be assessing your abdomen, which means I'll have to expose your abdomen. I have to listen to your bowel sounds and also feel for your internal organs. Sir, will that be alright? Okay, so before we start, I encourage you to void first. So it will be much comfortable for you while we are doing the assessment. Okay, so to ensure that the patient has emptied his bladder prior to the conduct of the procedure, because a full bladder can make the examination uncomfortable and it can reduce the accuracy of the bundle height measurement. Now, position the client in supine position with arms folded over his chest. Okay, sir. Okay, now cover the upper and lower body parts of the patient, leaving only the abdomen exposed. Okay, so do you feel any pain in your abdomen, sir? Okay, so I'll begin inspecting your abdomen first. Okay, first is the inspection. First, observe the coloration of the skin. Okay, as I observe, sir, your skin may be paler than the general skin tone, because this skin is so seldom exposed to the natural elements. Okay, next, note the vascularity of the abdominal skin. Okay, so as I observe, sir, the skin is scattered fine, the veins may be visible. Okay, next, note any stretch marks. Okay, as I observe, sir, there are no stretch marks. And next, inspect for scars and assess for lesions and rashes. Okay, as I observed, there are no lesions and and search and rashes. Okay, next, inspect the umbilicus. Okay, as I observe, the umbilical skin tones are similar to surrounding abdominal skin tones or even pinkish, which is normal. Okay, next, 72. Inspect abdominal contour. Okay, sitting at the client's side, look across the abdomen at a level slightly higher than the client's abdomen. Inspect the area between the lower ribs and pubic. Okay, as I inspect, the abdomen is flat and evenly rounded. Okay, next, assess abdominal symmetry. Okay, as I observe, the abdomen is symmetric. And next, inspect abdominal movement when the client breathes. Okay, as I observe, the abdominal respiratory movement may be seen, and especially in male clients. Next, observe aortic pulsations and observe for peristaltic waves. Okay, as I observe, slight pulsation of the abdominal aorta in the epigastrum, and normally peristaltic waves are not seen, which is normal. Okay, next, for the auscultation, warm diaphragm of stethoscope by rubbing it against your palm. Then place it beginning in the right lower quadrant and proceed clockwise, covering all quadrants. Listen for at least 1 minute of each quadrant. Okay, next, auscultate for vascular sounds. First is over the abdominal aorta, over the renal iliac artery, and over the femoral artery. Okay, so as I auscultate, brutes are not normally heard over the abdominal aorta or renal iliac or femoral artery. Next, listen for venous hum using the bell of the stethoscope in the epigastric and umbilical areas. Okay, as I auscultate for the venous hum is not normally heard over the epigastric and umbilical areas. Next is for auscultate for friction rub over the liver and spleen. Listen over the right and left rib cage with the diaphragm of the stethoscope. Okay, as I ausculted for friction rub over the liver and spleen, there is no friction rub over liver or spleen is present. Okay, next is now for the percussion. First, percuss lightly and symmetrically all quadrants clockwise or up and down over the abdomen. Okay, as I percuss, generalized tympani predominated over the abdomen, and dullness is heard over the liver and spleen. Next, percuss the span or height of the liver by determining its lower and upper borders. To assess the lower border, begin in the right lower quadrant at the MCL and percuss upward. Note the change from tympani to dullness, and then mark this point. And then to assess the upper border, percuss over the upper right chest at the MCL and percuss downward. Note the change from long resonance to liver dullness. Mark this point. Okay, as I percuss, the lower border of the liver dullness is located at the costal margin to 1 to 2 centimeter below, and the upper border of liver dullness is located between the 5th and 7th intercostal spaces. Measure the distance between the two marks. This is the span of the liver. Okay. When I measure the distance between the two marks, the normal liver span, the MCL is 6 to 12 centimeter, and the patient's measurement is 7 centimeter, which is normal. Next, percuss the spleen. Okay, as I forecast the spleen is an oval area of dullness approximately 7 centimeter wide near the 10th rib. Okay, next, perform blunt percussion on the liver.
Ito po eh. Isang
Unsa sa October? Ano ba mo?
Hinay lang. Ayaw gawa to ka Diyos mahapit na mabuwak yung buko.
Okay, next, perform blood percussion on the liver. Okay, do you feel any pain, sir?
No.
Okay, so as I forecast, normally, no tenderness is elicited. Okay, next, perform blunt percussion on the kidneys at the costovertebral angles over the 12 rib. Okay, sir, sir,
Pwede tamo.
sir. Okay, as I perform blunt percussion on the kidneys, sir, do you feel any pain? Okay. So there is no tenderness or pain is elicited or reported. Okay, next for the palpation, perform light palpation to identify areas of tenderness and muscular resistance. Using the fingertips, begin palpation in a non-tender quadrant in a dipping motion, then gently lift the fingers and move to the next area. Okay, sir, do you feel any pain, sir? I palpate your abdomen, sir.
No.
Okay. So, abdomen is non-tender and soft, and there is no guarding. Okay, next, simply palpate all quadrants to delineate abdominal organs and detects subtle masses. Using the palmar surface of the fingers compressed to a maximum depth of 5 to 6 centimeter, then perform by manual palpation if you encounter resistance. Okay, sir, do you feel any pain, sir?
So,
Okay, so mild tenderness is possible over the xiphoid, aorta, sigmoid, colon, and ovaries with deep palpation, which is normal. Next, palpate for masses. Note their location, size, shape, consistency, pulsation, tenderness, and mobility. Joke lang. For masses, note their location. Okay. Next, palpate for masses. Note their location, size, shape, consistency, pulsation, tenderness, and motility. Okay, there is no palpable masses are present. Okay, next, palpate the umbilicus and surrounding areas for swelling, bulges, or masses. Okay, so umbilicus and surrounding area are free of swelling, bulges, or masses. Next, palpate the aorta. Use your thumb and first finger, or use two hands and palpate deeply in the epigastrium, slightly to the left of the midline. Assess pulsation of the abdominal aorta.
Saan na?
Okay, the aorta is 2.5 to 3.3 centimeter wide with moderately strong and regular pulse, which is normal. So next, palpate the liver. Note consistency and tenderness. To palpate manually, stand at the right side and place your left hand under the client's back at the level of the 11 and 12 ribs. Lay your right hand parallel to the right costal margin. Then ask the client to inhale, then compress downward and inward with your fingers. Okay, sir. No, sir.
Tigat.
Sir, take a deep breath, sir. Okay, so the liver is usually not palpable, and if the lower edge is felt, it should be firm, smooth, and even. Okay, next, palpate the spleen. Stand at the client's right side. Reach over the abdomen with the left arm and place your hand under the posterior lower ribs. Pull up gently. Place your right hand below the left costal margin with the fingers pointing toward the client's head. Then ask the client to inhale and press inward and upward as you provide support with your other hand. Sir? Sir, can you take a deep breath? Yes, sir. Okay, as I palpate, the spleen is seldom palpable at the left costal margin. Next is palpate the kidneys. To palpate the right kidney, support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin of the chin. Palpate the right kidney. Support the right posterior flank with your left hand. Place your right hand in the right upper just below the costal margin of the Okay, next, palpate the kidneys. To palpate the right kidney, Bert, balik Bert. Okay. Hindi po. Next, palpate the kidneys. To palpate the right kidney, support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin at the MCL. Okay. Sir, can you take a deep breath? Sir?
Uy!
Okay, as I palpate, the kidneys are usually not palpable. If palpated, it should be firm, smooth, and rounded. And also, an enlarged kidney may be due to a cyst, tumor, or hydronephrosis. Okay, next, to palpate the left kidney, reverse the procedure. Okay, sir, can you take a deep breath? Okay, as I palpate the left kidney, also that the kidney is not palpable. Okay, next, palpate the urinary bladder. Palpate for a distended bladder. Begin at the symphysis pubis and move upward and outward to estimate bladder borders. Sir? Okay, so an empty bladder is neither palpable nor tender. Okay, next, assess client to comfortable position. Sir? Hindi na matindog, sir. And then, do the hand hygiene. Okay, and then document and refer for abnormal findings. So, sir, thank you for your cooperation, and that would be all, ma'am. Thank you. Hello,